Last but not the least, I'll also tell you about the effects of coronavirus on your fetus. So it is from all the study that we have, I told you we have very little data about it to come to conclusion. So all that I'm saying, all this information might not be relevant after a few weeks or months, and the guidelines might change because this we're constantly studying. Research is constantly going on about the virus, about the disease, about its treatment, and we do not have such a large database. The doctors and the scientists are too busy finding a treatment, or just controlling the infection to a point that we get rid of this pandemic that has taken over the entire globe. But we are not able to really reach a conclusion. We don't have a proper vaccine that can prevent coronavirus. We do not have exact medication that can save every person with a guarantee. So that is why I'm saying all that the information that I'm giving to you is true only till the date the video is being uploaded, because the research is still going on, and I am giving you all the information we have so far, right? So about your fetus, there is no kind of disease or problem or say chances of neonatal death or stillbirth that we see with a woman being corona positive that the child will face. Your child will not be born like with respiratory diseases or congenital malformations. That means that your child will not be structurally abnormal at birth just because you have coronavirus. So please don't worry about all this. Don't panic. The stress levels are very high. People are suffering anxiety and depression in general only, and with pregnancy we face this problem even more. Why? Because during pregnancy there is so much hormonal distress in a woman's body that she tends to feel a little more panicky than general population. So it is the duty of us as doctors, the husbands of these pregnant women, and the other family members of pregnant women, to give them the right kind of support, to be available to them, to talk to them, so that they don't feel these symptoms and they don't go into a shell, they don't succumb to these mental illnesses of anxiety and depression at this time. We should provide more and more support, and we should really sit down and listen to them at this point. If they are feeling very low, we should do some small gestures at home so that they feel a little lighter and happier about them, about life, about pregnancy, and they look at the larger picture. They see their pregnancy going forward happily, and a very bright future of themselves and their babies in future, and we all need to support it. In future, I will come again to you with more videos that will cover the exact kind of diet you should be taking, the exact kind of supplements you should be taking in your pregnancy, which actually are the same, which would be for a pregnant woman without the virus. So all that would be a general advice on diet and supplements, because they're just the same. No treatment for you will change right now because coronavirus is spreading across. Okay, you are going to take exactly the same kind of diet and the same kind of supplements that you would otherwise. There is no additional medication that is needed if you're not infected. But if you're infected, of course you will be isolated, you will be kept in a hospital, and we'll manage you accordingly. Also, there will be if you wish for a normal delivery, it is your choice if you want to go in for a normal delivery or a cesarean section. The process is going to be the same. Till now there is no guideline which suggests that you should be going for a cesarean section only because you are affected with coronavirus. You will have a normal delivery. You will breastfeed your child the normal way. The fluid around your baby, okay, that amniotic fluid in your womb, it is absolutely sterile. The virus does not enter it. So when your baby is in your abdomen, and even if you catch coronavirus, baby will not be infected with it. Even during delivery, the baby will not be affected. Even during breastfeeding, the baby will not be affected. Breast milk does not carry the virus. Okay, but yes, of course, precautions have to be taken. In case you're found positive, then we'll have to give you a respiratory mask. Every time you're feeding the baby, you'll have to put on the mask. Maybe in some cases, to avoid any kind of transmission, we might even suggest to express your milk with breast pumps and then feed the baby the milk instead of close contact breastfeeding. That is the only suggestion we might consider giving you, which is very individualized. So don't worry, just because you are more likely to get coronavirus does not mean you will get it. If you stay at home, if you maintain social distancing, if you maintain hand hygiene, then you will not catch it. And even if you do catch it, you will not transmit it to your baby. The baby will be fine, breastfeeding will be fine. Okay, be hopeful, be happy, and for any doubts you can always comment below, and in the next video I shall be covering all the doubts that you have. I'll try and answer almost all the questions. I hope this was informative. Thank you.